Hello, Dazzle. Thanks for coming and hanging out with me today. I'm glad that you're here. Today, I'm going to be talking about something really important: the state of healthcare in America. It's no secret that our healthcare system is broken, and it affects millions of people every day. Whether you're struggling with medical bills, insurance problems, or just getting access to the care that you need, it is a topic that hits home for so many of us. So let's break down exactly what's going on and why we need change. So let's start with the money because America spends a lot on healthcare, more than any other country in the world. On average, the US spends nearly $12,318 per person on healthcare each year. But what's shocking is how little we get in return for all that spending. For many people, high costs lead to financial disaster. Did you know that 62% of bankruptcies in the United States are linked to medical debt? That's heartbreaking, and it shows how dangerous medical costs can be, even for people with insurance. For those earning minimum wage, which is about $1,256 a month, just paying for health insurance premium can eat up 15 to 20% of their income. And that's without considering copays, deductibles, or the cost of medications. Healthcare shouldn't be this expensive, especially in a country with so many resources. So, with all that spending, you'd think that we'd have the best healthcare in the world, right? Not so much. In fact, the US ranks 11 out of 11 high income countries when it comes to healthcare quality, according to the Commonwealth Fund. We fall behind on key indicators like life expectancy, infant mortality, and managing chronic diseases. Countries like Australia, the UK, and Japan, where healthcare systems aren't driven for profit, consistently outperform us. It's frustrating to think that all this money still leaves billions of people with subpar care. The thing about healthcare in America is that not everyone can even get the care that they need. If you have a well paying job with benefits, you might not feel the struggle. But for millions of others, especially those in lower income brackets or rural areas, healthcare is often out of reach. Clinics are understaffed, wait times are long, and many rural hospitals are simply shutting down. It's especially tough in these rural communities where patients might have to drive for hours just to get to the nearest hospital or specialist. Even more concerning is the number of people who simply don't have health insurance at all. 27.5 million Americans are uninsured. These are people who fall into a gap. They make too much money to qualify for Medicaid, but they can't afford the marketplace insurance plans either. Without insurance, many avoid getting medical help, which can lead to untreated conditions and even more expensive emergency care down the road. It's a vicious cycle. One of the biggest issues in our system is that it is a profit driven system. Hospitals, insurance companies, and pharmaceutical companies operate like businesses, which means that their top priority is making money. Their profit is the goal. Care often takes a back seat to that. This can lead to inflated costs, unnecessary procedures, and a system where doctors are pressured to see as many patients as possible in as short amount of time as possible. For example, in the US, the average cost of an MRI is around $1,119, but in Australia, the same scan costs just $215. Why? Because our system is set up to prioritize profits over patient well being. Fixing this system won't be easy, but there are some clear steps that we can take. Many experts suggest moving towards a universal healthcare system where everyone has access to basic care regardless of income. Countries with universal healthcare like Canada and Germany spend less money and still get better outcomes. By cutting out the profit motive, we could focus more on patient care and less on padding the pockets of our insurance executives. We could also regulate drug prices, increase transparency in hospital billing, and expand Medicaid to cover more low-income Americans. Another big improvement would be investing more in preventative health care so that people stay healthier and avoid expensive hospital visits to begin with. It's clear that we have a lot of work to do. By talking about these issues as the first step towards change, we can push for a system that puts people over profits and makes sure that everyone has access to the care they need without fear of financial ruin. Well, that's about it for my rambling today. Thanks for coming and spending some time with me. If you like my rambling, then click on that like button. It really does help. And until we talk again, you guys be sure to take care of yourselves. Bye.